In the last 36 months, our company has written 50,000 new Medicare plans. Now, because we're Medicare brokers, these 50,000 new clients had lots of options to choose from. In fact, there's 10 different supplemental plans with 10 different companies offering those plans. On average, there's 45 different Medicare Advantage plans with 10 companies offering those plans. And so in this video, I'm going to share with you what those 50,000 clients chose for companies, but also the process behind this very important decision. So as we look at this important decision as to what company we want to go with, what we have to do is we have to really assess the situation. So as we're helping people and giving advice as brokers, we have a very methodical process we follow. And in this video, I'm going to explain the steps that are involved to make sure you understand. So step number one, we call this the discovery phase. And in this phase, what we're trying to do is answer this question: what's your particular situation? Everyone has a different situation. So in order for us to help you, we have to truly understand that situation. So here's the kind of things we're looking at. Number one, are you or your spouse still working? In other words, do we have an employer option that's available to you? We need to understand that. Also, is your spouse younger? Meaning if you have an employer option and you were to drop that, what would happen to their insurance, or children that are covered on a policy up until age 26? So in other words, we want to know the impact of this decision as it relates to your Medicare choices. Now, a lot of people aren't working at 65, so they don't have an option, but we want to know about it. Then we want to talk about what we call the timing of Medicare. So the first decision we have to make is make sure we're going on Medicare at the right time. Now, there are some people that actually have to start Medicare A and B at 65. And if they don't, they've made a mistake. And that would be anyone who's no longer working or their spouse is no longer working. We have no employer option available. You have to start Medicare at 65. Anyone that's covered by COBRA insurance. If you have COBRA and you're at 65, what happens is the COBRA insurance company moves to the second payer position. And so you have to enroll in Medicare A and B to put them in the first payer position. And if you don't, you become the first payer. The same thing is true with TRICARE, retired military. TRICARE pays first until you turn 65, and then TRICARE becomes TRICARE for life, and you have to enroll in Medicare A and B to put them in the first payer position. Same thing happens on a small employer plan. 19 or fewer employees on the payroll. What happens is Medicare says you've got to enroll in A and B to put them first, and that small employer plan is going to pay second. Anyone that's also on an ACA plan, Affordable Care Act plan, what happens is those plans, most people are getting some type of a financial subsidy. They're getting kind of financially incentivized on ACA plans. Reduced premiums, tax subsidies, cost sharing, all those things make an ACA plan attractive for most people. But what happens at 65, all those financial incentives and benefits are out the door. You're no longer going to get those. And so if the person does stay on an ACA plan at 65, they'll pay the full premium, they'll get no tax benefits, they'll pay full cost sharing, full max out of pocket, everything. You're not going to stay on an ACA plan once you're 65. So the point is, that's the 5 groups that must go on Medicare. And so as I talk about timing, we have to be aware of that. That means there's some people that don't have to start Medicare at 65. They actually can start Medicare after 65. They can do it at 66 or 67 or 72. It doesn't matter. Why? Because they or their spouse continue to work and were covered by an employer-provided plan. So my whole point is the timing of your Medicare decision is critical. Now, number 3, Medicare A and B enrollment. So once we've decided we have to go on Medicare, whether that's at 65 or after 65, then that enrollment process has to be taken care of. Now, when we talk about someone coming in at 65, this is called the initial enrollment period, and that only lasts 7 months. Those 7 months for enrollment are 3 months before you turn 65, the month you turn 65, and then 3 months after. And so we have to enroll during that 7-month window. So that's called the IEP. Now, keep this in mind. If you're on Social Security, you'll be automatically enrolled in A and B, the government using your initial enrollment period to enroll you into Medicare. But if you're not on Social Security, you actually have to initiate the enrollment. Now, if we come in after 65, the enrollment period is different. We call that an SEP. It stands for Special Enrollment Period. There's a different period, a different process, different different paperwork that's involved that you have to be aware of and of course, complete. So that is number 3 as we discover your situation. And then number 4, those that are already on Medicare. So if you're already on Medicare, now what you're probably looking at is you're looking at decisions about switching plans. You may be on an Advantage plan and want a different Advantage plan. Or you're on an Advantage plan, you want a Supplemental plan. Or you're on a Supplemental plan, you want to move to an Advantage plan. So we have to understand all that so that we can give you good advice. So my point is this, that is step number 1, the discovery phase. All right, that brings us then to step number 2, and that is a time where we have a discussion about what? Your coverage options. Right? And so as we enter into this discussion, here's really the question that we're answering, and that is this: how do you want to use your Medicare benefits? Not everyone wants their Medicare to look the same, but you're going to have to make this decision. We want to have a discussion around that. Now, let me just give you a very quick summary as to how people can use their Medicare benefits, and you have to choose one of these 3 options. So the first one is to do what we call A&B only. This is someone who has nothing beyond A and B, and there's about 10% of the Medicare population that actually selects this particular option. All right, now let me explain why and how this option works. I don't think it's a very good option. It's the first one I mentioned, but in my opinion, it's the worst option. And the reason for that is this: when we have A&B only, what we're doing is we're taking on a tremendous amount of financial responsibility. And the reason for that is because Medicare doesn't cover anything 100% other than preventive services. So if it's on your list of preventive services covered by Medicare, 100% coverage. But anything beyond that, you are always going to have a balance of the bill. That balance that is remaining is your financial responsibility, your financial liability. We call those gaps in your coverage, okay? And there's actually 6 gaps. So in original Medicare A and B, A is called the hospital side of Medicare. B is the medical side of Medicare. The A is the inpatient side. B is pretty much everything outpatient. And so in each of these 2 systems, A and B, we have gaps, financial responsibilities. And so on the A side, which means we go to the hospital, the first thing we're responsible for is the deductible. $1,676 to go to the hospital. That can be assessed multiple times in a year because it's not an annual deductible. It's tied to a benefit period. The next gap is if I'm in the hospital longer than 60 continuous days, I get into what's called an extended hospital stay. And now I have daily copays for month 3, month 4, month 5. These are pretty rare, but they do happen, and they're very expensive when it happens. Now, the last item that's covered on the A side, the inpatient side, would be skilled nursing facility. This is for someone that's had a stroke, maybe a hip replacement or an injury or an accident or a fall, and they need some fairly intensive rehab. They have to go to skilled nursing facility for that rehab. The rules are Medicare says you got to be in the hospital 3 days or longer, and then you can go to skilled nursing for the rehab. And Medicare covers everything. The first 20 days doesn't cost you a penny. But after 20 days, if you're still in need of care, we have 80 more days covered by Medicare, but you have a financial responsibility of a daily copay of $209.50. The average person right now is in the skilled nursing about 40 days. So they're paying 20 days at the $209, so a little over $4,000 they're liable for. So that is the A of Medicare, and those are your 3 gaps. The B of Medicare is, again, the medical side, the outpatient side, the MRIs, CAT scans, all those kind of things, outpatient surgery. We have a deductible. It's $257 this year, 2025. Now, this deductible is multiple times in a year. This one is just once a year. It's a calendar year deductible. Once we've met that deductible, then Medicare is going to pay 80% of the bill, and you are responsible for 20% of the bill. We call that coinsurance. So that's the second gap on the B side. And then lastly, this third gap does not occur often, but this is called excess charge. So this is a doctor you see or a surgeon that operates on you that is not obligated under contract to take the Medicare approved reimbursement rates as payment in full. That's doctor, adds to the bill, and they add 15%. This does not happen often. Less than 5% of the doctors do this. Now, it will happen, but again, it's a pretty rare occurrence. But when it happens, Medicare allows the doctor to add the 15%, and you're responsible to pay for it. And my point is, those are the 3 gaps that exist on the B side of Medicare. So if someone has A and B only and no other additional insurance, what happens is out of pocket, all these gaps they're now liable for. All right. And again, 10% of people choose to do that. That's option number 1. And then that brings us then to option number 2, and that is to have A and B with a supplemental plan. Okay, up here, we had a tremendous amount of liability, and with this, we're saying I don't want all that liability. I'm going to transfer some of that liability away to an insurance company. Now, what happens today is there's actually 10 different supplemental plans that are available, 10 of them. But of those 10, 2 of them, by far, the majority of people are going to buy. I would say probably roughly 95% of all people buy just 2 of those 10 plans. That's the G plan and the N plan. And again, they're filling in those gaps so you don't have to be out of pocket and responsible for them financially. So let's look quickly at the G and the N. All right, so the first one here is the G plan. This is what 70% of all people are getting today. And so the way it works is this. Remember, we had all those gaps. When I had A&B Only, I'm responsible for all 6 of those. But if I buy Supplemental Plan G, and I, of course, pay a premium for that G plan, it's going to cover 5 of the 6 gaps. So the only thing I'm responsible for is annually, a calendar year, I have to pay that B deductible. So as long as you see a Medicare provider and the service that you're having done is covered by Medicare, it is going to be 100% covered all year long other than that small B deductible once a year. So it's as close to full coverage as we can get today. That's the G plan. Now, the second most popular plan is actually called the N plan. Again, different letters, so it's a different supplemental plan covering the gaps just a little bit differently. And so what it's going to do is it's actually going to cover 4 of the 6 gaps. Like the G, you'd still be responsible for the once a year B deductible. And then, unlike the G, G paid the excess charges, but if you had an N plan, then you would have to pay that 15% when it occurs. Again, it's pretty rare. It can happen, but not often. But if it does, you would have to pay that out of pocket. All right. Now, in addition to those 2 gaps not being covered, you have 2 other items with an N plan, and that is every time you were to see a doctor, a specialist, a surgeon, went to an office visit, then you would be responsible for a copay of up to $20 for any doctor and up to $50 if you went to the emergency room. So again, some very reasonable copays. And so the difference would be a little bit in coverage here, and the difference in price on average is about $40 a month. Some states are going to be a little bit higher, some a little bit lower. We're Medicare brokers throughout the country, so it's going to vary. But the point is, we're going to pay a little bit more for the G and the N a little less, but we take on just a little bit more liability. And so if there's a $40 difference and I had the N plan, I saved $480, and I'm willing to have a few copays and take on the minimal risk of that 15%. Both are wonderful options. They really are. Just depends on what's most important to you. Some say I want the most full coverage I can get. That would be G. Others say I still want a supplemental plan, but I'm going to take on a couple copays, the risk of this, since it's very small. Okay, and then they decide to go and pocket that extra monthly savings that will differ between those 2 plans. All right, I'm going to show you the third option as well. But just before I do, I want to mention something just real quickly. There's a lot of people who decide they want a supplemental plan. And so what we put together, we actually put together a quiz that's very helpful. And you'll see a link here in the description below. You can actually click on that link anytime during the video or after the video. And what it'll do is going to take you to just a handful of questions that you can answer. And then your answer to that question will really help you then to decide what's going to be the perfect fit for you. So at the end of the video, if you want to take that quiz, I think it can be very helpful. All right, so let's go back to our third option here. We know we have A&B Only, we have A&B with the SUP, most people G are in, and then we also have A&B that's replaced by what they call the C plans. And this is Medicare Part C, and these are also called Advantage plans. Okay, so this is a different system. Up here, what happens is Medicare is making all these decisions. We're under the umbrella of all the Medicare rules. Okay, what happens with Advantage plans is I'm still enrolled in Medicare A&B, but now what I have is I have this private health insurance company. And so when we say it's been replaced, this is a private health insurance company. Again, you're still enrolled in Medicare, but now you have this private health insurance company that puts together what they call a managed care plan. So this is managed by Medicare. This is managed by that private health insurance company. So let's look at the Advantage plans versus the supplemental plans so you'll understand the differences of this very important decision. All right, I put this chart together because having been in the business now 17 years, I know that what people really have to decide is how do they want their insurance to work. If they got cancer or some other kind of serious health issue, how do they want their Medicare benefits to be provided to them? So we're going to look at these different features and make a comparison between those who choose supplemental plans and those who would choose Advantage plans. Again, they're both good plans, but they're different plans, and so you need to understand the differences. So let's go through and talk about this. So as we talk about the differences, first of all, I want to talk about providers. If someone says to me, hey, I don't want want to plan choosing my doctors. I don't have to worry about networks. I want to go to any provider as long as they take Medicare. Well, then that would be a supplemental choice. The reason for that is because with supplemental plans, as long as that provider, the hospital, the doctor, takes original A and B, they have to take your supplemental plan of choice. Whatever letter you choose, whatever company you choose, they have to take the plan. Not so when it comes to Advantage. Those are designed to have HMO and PPO networks, and so you can go to providers as long as they're within the network. Now, HMOs, you can't even go out of the network unless it's an emergency. If you go out, it costs you more money. PPO lets you go out, but again, it costs you more to go out of the network. My whole point is here, we're definitely going to be limited. Here, it's almost unlimited because almost all doctors take Medicare. All hospitals do. Okay, so you have to make that decision first about providers. The second feature would be national coverage. And again, it just simply means when you pull out your card, how is that service provided to you? Is it going to be understood, or are there going to be some distinct differences in this coverage? And again, when it comes to a supplemental plan, it is a national plan. It doesn't matter whether you're in Anchorage, Alaska, or you're in Miami, Florida. You pull out your A and B card and your supplemental card, everybody knows how that system works. Not so when it comes to Advantage. It's not a nationwide plan. Normally, it's going to be a local plan or a regional plan. And so you pull that card out, they may not be as familiar with that plan. Now, again, if it's an emergency situation, you're going to be covered, but you're not sure exactly how that coverage is going to work. And so that's the difference between these two. Now, number three, let's talk about lifetime plans and portable plans. Lifetime means it can never be canceled by the insurance company. It's a portable. That means I live in Denver, Colorado, and I want to move to Nashville, Tennessee. I can do that if I have a portable plan. And so again, that's the way supplemental plans work. They're lifetime, never cancelable, can never be canceled by the insurance company unless you don't pay the premium. Okay, they can't cancel because of claims, because of age, because of location. That is truly your policy for the rest of your life as long as you pay the premium, regardless of where you live. It's also, portable, take it with you, but notice on the Advantage side, if you're looking for something lifetime, that's not Advantage, because Advantage plans are 1 calendar year and that's it. They come and they go. Companies are in a market for a while and they pull the plan. It happens on a regular basis. They're not portable. If you lived in Denver, Colorado and just moved to Dallas, Texas, you're not taking that plan with you. You have to get a new plan when you move to Dallas. Now, they make that possible for sure, but again, you have to line up new doctors, an entire different insurance plan. All right, number 4. Pre-authorizations. Let's talk about this. Pre-authorization means you need some kind of an expensive healthcare service. This would be an MRI or a PET scan, CAT scan. It could be an extended skilled nursing stay. It could be an outpatient surgery. A variety of things that are expensive. And what happens when it comes to pre-authorizations, this means the insurance company has the right to make the final decision. So the way it works, if I have a supplemental plan over here, I never have a pre-authorization ever. That insurance company covers whatever Medicare covers. Medicare pays, they pay. Not so when it comes to Advantage. About 70% of the services on an Advantage plan are going to have a pre-authorization process. Now, they may approve it, but they don't always. Sometimes they delay and say, no, we want you to go to therapy. We're not going to pay for that knee replacement yet. Or no, we won't pay for a full hip replacement. We'll pay for a rod. And so my point is, over here, your doctor recommends, then goes through the pre-authorization process to see what the insurance company says. Over here, it never happens. Your doctor knows what Medicare is going to cover. Medicare says they'll cover it. The insurance company never has a say-so. They can't delay. They can't deny. Medicare pays. They have to pay. All right, so again, that's a difference. Let's talk about number 5, no referrals. Now, when it comes to referrals, this means that I want to see my specialist. I want to go to my cardiologist, or I want to see a dermatologist. And in order to see that specialist, sometimes you have to have a referral from a primary care doctor to make the recommendation. And so again, over here, we'll never have that with a supplemental plan. Call the doctor up, make the appointment. No referrals required. Over here, sometimes we do, and that's typically would be with an HMO plan. They oftentimes require referral to see a specialist to make sure that specialist is going to be within the network, so it will be covered for you. All right. Now, number 6, and that would be predictable costs. Some people want to know exactly what it's going to cost them, or very close what it's going to cost them. And so when we're looking for predictable costs, that would always be a supplemental plan. And the reason for that, let's use the G as our example. I know what my premium is every month. I have to meet my B deductible once a year, so it's predictable. I'm not going to have any surprises whatsoever. Over in this particular system here, it's usually not predictable because it's a pay-as-you-go system. You pay daily copays to go to the hospital. You pay a daily copay for skilled nursing. You pay $50 to see a specialist, whatever. So all these healthcare services you're going to pay as you go until you hit the max out of pocket for the year. So I'm not saying this is bad. I'm just saying to you, you can have some surprises because you're not sure what health problems you may face in the future. And so again, this is a pay-as-you-go system. This pay a premium, deductible, you're done. And then A and B. In order to be on a supplemental plan or an Advantage plan, both of these are the same. In fact, it's the only thing they have in common, and that is that you have to be enrolled in A and B. A is free for most people. B is going to have a premium. This year, that premium for most people is $185 a month. Comes out of your Social Security check, or they'll bill you for this on a quarterly basis or do some kind of a bank draft. But my point is, you got to pay for your B premium no matter which one of these systems that you're a part of. So that's what they have in common. Now, let's talk about just two more items, and that has to do with zero premium. There are some people that, beyond paying Medicare, they don't want to have to pay a premium. They just can't afford that, or they don't want to afford that. And so if that's what a person's looking for, that's where the Advantage plan is going to win out for sure, because supplemental plans always have a premium. You took all those liabilities, you transfer those to an insurance company, you have to pay them a premium to take that liability from you, whether it's a G plan or an N plan. You got to pay for that. Okay, over here, it's a pay-as-you-go system. So other than paying Medicare, most of the Advantage plans have a zero premium. Why? Because you pay as you go. $400 a day to go to the hospital. So I got to pay a daily copay. Over here, it doesn't cost me anything to go to the hospital at all, because my supplemental plan is going to cover that for me along with Medicare. All right, and then lastly, when it comes to perks. Now, perks would be things like gym memberships, a dental allowance, a vision allowance, hearing aids, those kinds of things. Again, over here, they're going to win out because they're full of perks. That's what Advantage plans do. They give you some additional perks that original Medicare and supplemental plans do not cover. And so you'll notice that why I share this whole list with you, you have to decide what's most important to you. All right? Now, I would encourage you, I don't think premium is everything. I think premium is important for sure, but it's not everything. Though I have a zero premium here, I could have a max out of pocket of anywhere from $4,000 to $10,000 for the whole year. But I do know this, there's some people that can't afford a premium. It just doesn't fit in their budget. That's when Advantage plan is probably going to be in their best interest. But those that can afford a little extra, I think there's a lot of benefits, no perks, but a lot of benefits, because that insurance is going to work very easily and very smoothly for them. All right, that brings us then to step number 3, which is very, very important. And what we're going to do is we're going to talk about the companies. Now, just before I get into that, I do want to clarify something real quickly for you. There's a lot of people who are not aware of our YouTube channel. You may be watching this on YouTube, but if you want to stay up to date with everything Medicare and everything Social Security related, then I would encourage you, just follow the link here and actually become a subscriber to our channel. And it didn't cost anything to do that, but the reason I'm suggesting is because I shoot at least one and usually 2 new videos every week, and we have other content creators within our company, other agents that also help. So our goal is to help our folks that are part of our channel to actually stay up to date on everything. So you can click to subscribe. And also, if you don't mind, if the video is helpful, give us a thumbs up. That just lets YouTube know you liked it, and they'll send that out to other people. And that's helpful for them as well as for us. And if you want to leave a comment, maybe Marvin, hey, you talk too fast, or I hear that a lot, and I'm sorry for that, or something that you would like me to cover that I haven't covered, we'd be delighted to hear from you. Leave a comment, and we'll definitely respond to that as well. All right, so let's keep going. Now let's talk about this issue here, step number 3, and that is we're going to have a discussion after we talked about coverage and your different options. Now we're going to talk about companies, because there's a lot of them. As I said in the intro, there are 10 different supplemental companies available in most markets and 10 different Advantage companies in markets as well. So you got a lot to choose from. So let's answer this question here. Which company, and this is key, you all, which company are you most comfortable with? And that's really what it boils down to. You have to make the decision as to which one you think is going to serve your interests now and into the future. So that's what the question we're going to answer. So what I'm going to do, we're going to talk first of all about supplemental plans, and then we'll look at Advantage plans and the different companies that are available. So let me clarify some things about supplemental plans as you look at the different companies. Number one, I want you to know this, that all 10 of those letters in supplemental system, which is A, B, C, D, F, G, K, L, M, and N, all 10 of those are standardized by Medicare, which means what? It means Medicare sets the rules for that G plan. What's covered by the G plan? Everything but the B deductible. As long as Medicare covers the service, you're seeing a Medicare provider, that plan follows Medicare. So it's going to pay everything that Medicare doesn't except for the B deductible. That's it. That's your one gap that's not covered by G. So if you buy a G plan from ABC Insurance Company or a G plan from XYZ Insurance Company, it doesn't matter because they're standardized. They're all going to pay the same bills, the same type of bills, and the same amount of bills. If I get that N plan, what's going to happen? I have to pay my B deductible, excess charges if and when they occur, and some copays to see the doctor or go to the emergency room, right? But it doesn't matter what carrier I go with, that coverage is going to be identical. That's standardized by Medicare. The second thing that's important is this: the initial premium being charged for your first year, as well as premium increases. Premiums go up, but some companies tend to go up more frequently and more drastically than others. So yes, I care about the initial premium, but it's not the end of the story. I also want to see the history of that company to see how stable their rates have been over the long haul. All right. And then number 3, a regional supplemental plan versus national. Okay, this is also a big deal because there are some regional carriers, meaning they only cover maybe 5 or 6, 10 states or so, and you have others that cover all the states. And so why this matters is because this contributes to the stability of the rate. And here's the last thing I want to share about this, and this is truly the key to stability of rates, meaning premium increases will occur, but I want a company that's proven to be stable over the long haul, and that is this: what kind of a market share do they have in that particular market? We had a lady not long ago that was looking at a couple companies, one national, and they had in that market, she was in about 33,000 policyholders. She was looking at a regional carrier, and I think there was 200 to 300 people totally in the group. Okay, so one over 30,000, one just a few hundred. Who's going to give you the most stability? Well, most certainly the larger group. Why? Because the risk of health problems within the group is spread out to more people. I'm going to give you just a quick illustration of this, kind of silly, but it's very true. If you were in the ocean and you were in a canoe in the middle of the ocean, I can assure you it's going to be a rough ride. You're going to feel every single wave that hits that canoe. But you can be in that same ocean and be on a cruise ship, and you hardly even know you're in the middle of the ocean unless there's a storm or something, but you'll feel it, right? Why? Because that's a large vessel in that body of water. You don't feel the impact of all of the waves. But if I'm in that canoe, I'm going to feel all of them. And so here's the point. If you're in a group plan that's regional and they do not have a large market share, and we have a lot of health problems within that health group, cancer and heart issues, different things, so you're probably going to feel the impact of that through more price increases. But if I'm in that cruise ship and that large group, yes, those prices are going to go up, but probably not near as substantially as they would in that small group plan. So again, that's what we're looking at with the carrier. I care about initial premiums, but I also care about what's the history of the price increases with that company. All right, so that now brings us then to really the gist of what I'm trying to teach you today, and that's all about the companies within our most recent 50,000 clients. And so the supplemental companies, there's actually 10 of them in this 50,000 group, but you're going to notice that some carriers write more of the business than others for sure. So let's go through this together. First off, when it comes to supplemental companies for our 50,000 clients, 57% of them, just about 22,000. And by the way, I want to share this with you before I get into this. Of those 50,000 clients, 80% chose supplemental plans. Okay, 80% of them. And then, of course, 20% chose Advantage. So of the 80%, that's what I'm saying, 22,000 policyholders chose to be covered by United Healthcare. Now, we put on the board AARP. AARP is, they're not an insurance company. They just simply endorse United Healthcare. United Healthcare actually has 2 different divisions to their company. They have United Healthcare and also one called United Health Insurance Company of America, UHICA. And so they're both United Healthcare, but one, United Healthcare division carries a wellness benefit, gym membership, eye and dental discounts, as well as 24/7 nurse line. That's a wellness benefit. The one that doesn't cover that wellness benefit is called UHICA, and the rates are a little bit lower because, again, you don't have that wellness benefit. But the point is, 57% of our clients went with them. Again, so it's United Healthcare is the insurer. AARP is just simply the one that endorsed that particular product. All right, so that's the way that works. Let's look at the second most common carrier within our business, and that's going to be Aetna. Aetna, we actually wrote 6,000 policies of these 80% of the 50,000, and so 15% actually selected Aetna, again, a good company, been around for a long period of time. Number 3 was Ace Chubb. Ace Chubb, a little bit new to the MedSup market. Chubb is a very large insurance company, property casualty company. They started a Medicare division a few years ago, and they called that Ace. We wrote 4,024 policies from them. About 10% of those on SUPs chose them. Number 4 would be Aflac. We're all familiar with Aflac, the duck and all that, and they're fairly new to the business, but in some markets very competitive, and we think they'll be stable as well. Again, 3,439 policies, 9%. And then Cigna, again, a household name. We're all familiar with Cigna. And again, about 1,600 policies with them that we wrote. And then Mutual of Omaha, a well-known company throughout the country. But in our company, our business, we just wrote 700 policies with them. Anthem, Blue Cross Blue Shield, depending upon where you are, they can be called one or the other. Again, 1%. And then we have just a couple of carriers that are very small, Allstate, Humana, and Transamerica. I do want to mention something about Transamerica. We used to run a lot of business for them, and then they changed the way they do business, and it's all just direct to consumer. In my opinion, they're not very competitive anymore, but years ago, we wrote a lot for them, but they just changed the way they do business. So these are our top 10 carriers with our clients that selected the supplemental plans. And so again, what are we looking at? We're making sure we have a company that has a good market share, that has a good initial premium, but also stable rates. And so when we work with our clients, we're looking at all these different companies and coming up with the answers to those questions. All right, next I want to look at Advantage plans and the different companies that were available as well. So as we really look at the details of Advantage plan, here's some things that you need to be paying attention to if you go with an Advantage company. Number 1, are your providers in the network? We have 2 types of networks, of course. We have HMOs and PPOs. PPOs are much larger networks. The providers get paid more, so they're willing to be a part of that network. HMOs get paid less for sure, so you're going to have less choices. Now, it doesn't mean you won't have plenty of choices, but there definitely are going to be less hospitals and less doctors in the HMO. Now, remember, if I get a MedSup plan, I don't deal with networks whatsoever, but I'm always going to have to, with an Advantage, make sure your providers are going to be within the network. Then number 2, prescriptions. These are Part D plans, embedded, included within the Advantage system. The Advantage system picks a drug plan out for you, embeds it in the coverage, so you have to make sure that your prescriptions are going to be in their formulary. Number 3, we're going to look at copays. What will it cost you to go to the hospital? What will it cost you to have an MRI? What's it cost you to go to the specialist? What will it cost you for durable medical equipment? But these are out-of-pocket expenses, copays, and coinsurance that you're responsible for up to what we would say would be the max out-of-pocket. So I pay copay until I hit the annual max out-of-pocket. It could be somewhere between $4,000 to maybe $5,000 on an HMO for the whole year. PPOs may be $5,000 to $10,000 out of pocket for the whole year. But once I've reached my max out of pocket for the year, then I no longer have any more out of pocket expenses, and then my max out of pocket will reset every January, and then I'm back to paying copay again until I hit the max out of pocket. So that's just the way they're structured. And then perks. And again, we talked about the perks. This could be a gym membership, dental allowance, vision allowance, hearing aids, those kinds of things. That could be a part of that, but what you have to pay attention to is not just what is the perk that's being advertised, but how do you use it? Is it going to require you to go to a network dentist, maybe a network provider of hearing aids? So there's a lot of issues that come with perks that you have to really pay attention to the fine print and to the details. All right, and then lastly, again, we have regional Advantage plans. In other words, they just cover using maybe a state or a few counties of a state, or actually a national plan. And again, if you have a national plan and you find yourself in an emergency, there's probably going to be some awareness of how that plan works. If you have a regional plan and have an emergency, you're going to be covered, but you're not sure exactly how that coverage is going to work. And so that would be the difference. All right, so those are the things we've got to pay attention to if we go with an Advantage plan. Now, let's look at the specific companies. All right, now the average market has about 45 different Advantage plans available. Now, some big, large metropolitan areas would have more than that, but across the country, there's 4,000 Advantage plans. The average market has about 45 plans available to them. All right, so here's the 10 companies that we wrote in the last 50,000 clients. Number 1 was Humana, very familiar, very large in the Advantage business. You saw earlier we write very few supplemental plans through Humana, because really Humana, their bread and butter would be Advantage plans. All right, so 3,218 of those. And remember, this is 20% of our clientele. So 80% chose SUPs. That would have been of the 50,000, been 40,000 of those, and then 10,000 would have selected Advantage plans. All right, so we have Humana 3218. About a third of all of our clients went with them. And then again, back to ARP, again, not an insurance company. United Healthcare is an insurance company. ARP endorses that product. And so about the same thing here, just a few less with United Healthcare Advantage plans. Number 3 would be Aetna. Again, a good household name, still very popular, about a fourth of our business. And then Anthem Blue Cross Blue Shield, and now we're starting to drop, so you can see pretty drastically. These are typically going to be some more of your regional type of plans. 444 is all we wrote. And then Cigna, 4%. Now the reason for Cigna is because they primarily emphasize their HMOs, and a lot of people don't want those. They want flexibility on a PPO, but again, sometimes it's a very good fit. And then WellCare, of course, 293 plans, that's 3%. They'd be in most states, not all, but many. And then Devoted, very small, specialized type of Advantage plan, good in some particular areas for certain conditions for sure. And then AmeriVantage, again, very small regional carrier, all well, and Essence as well. So you can see the kind of the popularity here. When we look at the top ones here, that would be what, 65, 68, 88% of all of our clients chose either Humana, United Healthcare, or Aetna. They're the ones that dominate the market. And I'm not saying all these others are not good, but it just depends on the structure and the type of the plan, the coverage, and the network. And so most, of course, decided among those 3. All right, that brings us into the final step, and this is step number 4, and that is really the decision phase. And here's kind of the philosophy of the way we do business is this. You decide. We truly can be neutral. We write all the plans, and we write for many, many different companies. So we can be unbiased. We truly can be. We want you to decide. We want you to have the right information, accurate information, honest information, so you can decide. And then once you decide what coverage you're looking for, whether that's a supplemental plan or an Advantage plan, and what company you want to select, again, that's your decision. And then we'll take care of the rest. And we're one of the few brokers that actually will do things this way. Let me explain what I mean by that. First off, we will take care of your A&B enrollment if that's what you need. Now, if you're on Social Security, you'll be automatically enrolled in A&B. But if not, you're going to have to enroll. And all day long, every day, we enroll our clients into Medicare A&B. We're happy to do that for you. You do have to have a myssa.gov account. If you don't have that, we'll help with that as well. If you're coming in at 67 or 72 because you didn't start Medicare at 65, you have some additional paperwork that's necessary called an L564 and a CMS 40B. Those 2 forms, we'll actually initiate those for you and give you instructions as to how to get those completed and get those submitted to your local Social Security office. But we take care of that A&B enrollment for you. Be delighted to do it. Then number 2, all the insurance applications that are necessary. So if we do an Advantage plan, it's one insurance application after we have the Medicare A&B set up properly. If you happen to go with a supplemental plan, we have to make sure A&B, but also the supplemental company and a prescription drug plan that's going to be separate. All right, and so we'll take care of all those insurance applications, making sure that they're done properly and, of course, submitted on time as well. Then number 3, the policies are actually mailed to you as well as the insurance cards. So if you decide to do an Advantage plan, you're enrolled in A&B, but you don't use your Medicare card. You're going to be given 1 card for inpatient, outpatient, and prescription drugs. If you are going to stay in original Medicare and get a supplemental plan, you actually have 3 cards. We use A&B and the supplemental card for anything inpatient and outpatient related, and a separate card for our self-administered prescription meds. So it's just a different system, but all those cards, of course, will be mailed to you. And then number 4, one other thing that's very unique about us is we as a broker, because we're large enough, we have our own customer service department. And so the majority of people today, when they call customer service, they're normally transferred to India or the Philippines or China, some international call center where they can get cheap labor, okay? And again, I don't fault the people who work there, but what happens is sometimes you can't understand them well, and I think sometimes they don't understand Medicare very well. But our clients never have to do that. You have a problem, any kind of an issue that you have, you call our office, and you're transferred to our customer service team, and they will help you with any problem you're having whatsoever. You're not going to be transferred overseas. You'll go right into our home office, and we'd be delighted to take care of you. So that's the way we actually do business. And so again, you decide, and then we can take it from there.